The content of this podcast is based on medical fact and evidence-based practice from credible, authoritative sources, but is not a substitute for your institution's policies, procedures, common sense, or good judgment. The views and opinions are those of Eric Bauer and FlightBridgeED in their entirety.
In the early 2000s, this was my life. I had just finished EMT school. I met my wife at EMT school. She was in my squad for my group. She missed the first day of school. And she had her hair down. And the rule was, obviously you're in your uniform, you put your hair up. And so I kind of yanked on her hair and I was like, I need to fix this. And walked away. And in true Latina form, she was pissed. And it was all right. Later on, about 8 weeks later, we were doing this communication practice where you have to look at each other and take a step closer and take a step closer. And you can't show any emotion. You have to be neutral. You can't laugh. You can't do anything. And every time we took a step closer, she was doing this at me. I was like, what the hell's wrong with her? And finally, when she got about a little more than arm's reach away, she goes, "You have a booger in your nose." And I went, "Oh." And then we dated about 2 weeks later, and we dated every day after that. So, as they say, life was good. Go to the Winchester, have a pint. I was teaching. I was in the military. I was in the Army. Everything was awesome. It's early 2000s again. I was a medic in the Army. I was a part of a tactical medic team that was attached to a SRT unit, kind of like a SWAT team for the military side of things. So it was awesome. I had a great job. And I knew that I was safe, and there was really no wars going on at the time. Then this happened. And my life changed instantly. September 11th is my birthday. This was my 21st birthday when this happened. I was in bed, drunk. And I get a phone call. "Hey, Special Olvera, this is a warning order. We need you to come in, blah, 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 blah." "Yeah, right, guys. Ha, real funny. It's my birthday. You guys are funny. Ha. And I hung up the phone. And they called me back and they go, "No, we're serious. Turn on the TV." And that picture that you see right there is what I saw. I saw the second plane hit. And I went, "Oh shit. I'm going to have to actually play Army." So fast, really fast after that, my life changed. Activation happened. I went to tactical medic school through H&K. I got sent to Iraq. That picture on the bottom there is of me when I had just completed raiding a police station in a town called Bakuba, which is northeast of Baghdad. And we had gone in there. There was a police chief, and the police station was corrupt and was doing things that probably weren't the most appropriate things. And so there was a team of us that went in there and raided the police station, took over care, and took over the police station and the daily ins and outs. So where does that go to us? So we can see here human factors and task saturation. What just happened? My life changed. What happens to us in EMS? Our EMS time changes, right? So this is a great quote. "One of the first things to go when experiencing task saturation is communication." How many times have you been with your significant other, have been in an argument, and you can take a step back for a second and say, one of us didn't communicate, or both of us didn't communicate? It happens. When we get such tunnel vision and we get locked in, task saturation happens. We lose communication. Loop closure, for those that know that phrase of things. All those things fall apart. So then we look at this and we say, well, what makes human factors more complex to that? Where are we at with task saturation and now adding human factors into it? So we have to decide what's most important. Is the patient important? Is my safety important? Is this patient more important than that patient? I was talking to my team of my new position. I work in hematology oncology clinical research now. So completely different change from being in the military and being on a helicopter and stuff. And we were talking about decision-making skills. And I was talking to them about how we use some of the triage methods we use when we have a mass casualty. And I said, sometimes there's a person that you have to call a black tag that you don't want to call a black tag. And I went through the description of that to them, and they were stunned. And they were like, whoa, wait a minute. And I said, sometimes we have to make that decision. And how do we work through that? That you just walked away from somebody who, in a normal day, you may be able to at least get to the hospital, and now you have to move, right? The panic sets in. Did I make the right decision? Buyer's remorse, right? So those of you guys that bought a house or a car, the next day you're like, was that the right idea? Where are we at with that? Those different things. And so here's an interesting paper that talks about that, and I'm going to read this directly from the quote. Task saturation is defined as the perception or reality of having too much to do or not having enough time, tools, resources to get them accomplished. In order to stay productive, you must figure out what's most important, stay focused on the matters, and create time to be creative. Checklists, cross-checks, mutual support. We all have our interagency battles. We all laugh when a police officer picks up a fire hose. We all stare at each other on the helipad when the other company lands. But when it really comes down to it, we all need each other. Cross-checks. What do they do in the OR now? They do a timeout, right? Anybody here do a timeout when they do their airway and their checklist for intubation and whatnot? Okay, a safety timeout, or, there's different names for it now. And then the checklist itself. So it's really interesting. So when we look at checklists themselves, there is this Dunning-Kruger effect. And so what happens is we train, we learn it, we become what we feel very confident in what we do. Then all of a sudden that confidence, kind of what Rob was saying, experience gets in the way. Okay? And when we have that experience get in the way, we have these situations where this isn't textbook. Because when I walked out of EMT school, I was nervous. I wasn't quite confident, but I felt like I knew what I was doing when I walked out. And then my first call, I walked on scene, I went, this isn't anything that I know. And I walked out and I was like, hold on for a second here, I got to figure this out. It's a very interesting thing. When I had helped out with the start of a data collection of an airway for a residency program at a university, it was very interesting to see this happen without even knowing what it was. The residents, emergency medicine residents, were trained to the highest potential of airway management. This was at the beginning of the videoscopic intubation times. And what we had learned is that their first intubation, they may have missed. Second intubation, they were good. Third intubation, they got. But for some reason, every time, the fourth intubation, they failed on their first attempt. So what happened? This effect took place. And as you do more and more intubations, you learn about the different things that happen. You learn about the different classifications that can cause a problem. This happens in our career in EMS, right? We get very confident when we're on the ambulance after 7 to 10 years. And then we jump into a helicopter, and all that confidence takes a step back for a second because you're like, wait a minute, I have to do it in the size of what? In a tin can? Sardine can? And it changes. So then adding these checklists, like you can see here, adding that helps with that task saturation, helps with that offload that it talked about in that definition. It talks about that cognitive relief. And how having to do it, you talk to somebody back and forth. You talk to the person who's reading the checklist to you. Now, in this specific case, you have a third-party entity who is not on your team read it to prevent errors, to prevent that, I always know they push sucks and accommodate. Sorry, Rob. They always push sucks and accommodate. And we know that, and so then we move past it, and then we have a mistake, and we have an adverse event. Okay? So let's bring that back to us. What about me? How do I take care of me? Well, this guy, his name is Mike Laria, right? If you don't know who he is, Mike, stand up. If you don't know who Mike is, just Google him and be amazed. He is a mentor to me. He is a hero to me. He has taught me so much. So what you see here, the QR code, you can reach his podcast that he's done. But he talks about this thing called Beat the Stress Fool. Mike, can you give us a Beat the Stress Fool for me, please?
Beat the fool.
There it is. I can't give it justice to what he does. So it breaks it into 4 corners, right? So the first thing we talk about we talk about tactical breathing. Okay? We breathe. So the tactical breathing is in for 4, hold for 4, out for 4, hold for 4. Okay? Doing that as you're on your way to the scene, doing that as you're walking up to the patient going, oh shit. As you're doing that, do that breathing. As you're at the bedside and you're getting ready to do the intubation, do that breathing. Have it become second nature to you. Okay? Then you're going to do a self-talk. You're going to talk yourself through this and say, I can do this. I'm pretty good at this. It's really weird. You know, my mom did a lot of brain research when I was younger, and there was this thing where she said that if you say, I'm going to have a headache, 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 and keep saying it, you're going to have a headache. Same thing works here conversely. If you say, I'm going to crush this airway, ooh, bad choice. I'm going to do great at this airway. I'm going to intubate this patient. I'm going to be awesome at this. I know what I'm doing. I've trained for this. This is my moment. This is my time. This is my day. And I talk myself up. I'm going to do better. Then you're going to do a mental rehearsal. Okay? And what that means is you're going to walk through the process of that intubation in your head all the way through from start to finish. And you're going to walk through it successfully. Okay? So there is, I can't remember exactly who told me, so I apologize, but there is somebody that once told me that the person who's done the most surgical airways in the world has never actually had to physically do one. But what they do is they're in the garage of the hospital, they sit there, and they run through the entire surgical airway before they walk into work. So they sit in the car, and they get the kit, and they open the kit. They put their gloves on. They identify the spot. They go through, and I'm doing this very shorthanded, but they go through, they make the cut, they put the bougie, and they put the tube, and they high-five their partners, things like that. They go through that every single day before they walk into the hospital. Okay? And the last thing is a trigger word. What is your trigger word to go? What's that thing that makes you go, woo? All right, let's do this. All right? So everybody asked me what my trigger word was when I was in the military.
All units, Irene. I say again, Irene. Checking one ready. 5, 1, 5, ready. Dog, 4, 1, ready. Irene! Flag, got the Irene. Fucking Irene!
So, in my team, our word was Fiona. We are, the head of our SRT unit was about 5'3", and he looked like Lord Farquaad. And so we'd be on a stack getting ready to go, and you tap each other up, right? You tap and you tap, and then you'd be on the radio and you hear Fiona. You're like, oh, it's time to go. And then you tap each other up. Okay. One day we were doing a dismounted patrol, and we were walking through downtown Bakuba, and a local townsperson came up to us and said, hey, there's something in the middle of the road. I don't know what it is, but it's not normal. I think it might be a bomb. And so one of the guys on my team had been trained in explosive, but was not an explosive person, and said, let me take a look at it. We'll do a UXO. We'll call it in, and we'll get it taken care of. I looked away for a second. Boom. Oh, shit. Was I task saturated? I don't know of a bigger word. Did human factors come into play? Absolutely. I lost all common sense of what was going on. First thing I wanted to do as the medic is I wanted to run over and make sure he was okay. I had to stop. I could see him moving. He turned his head at us and looked at us as a team. The Kevlar that he was wearing saved his chest. Kevlar saved his head. Well, it wasn't protected. And so finally we secured the area. I was able to go over to him. My partner and I did what we could. We got him to the closest hospital, and then he unfortunately died en route to Germany. I had to stand there. And when I came home to the United States, I had to listen to the why, what happened. So while I was over there, I was trying to deal with all of this, trying to process all of this. Holy crap, this game of okay, I was getting shot at, that's kind of cool, I'm 24 and okay, this is all right, and then all of a sudden it became real. Someone died that I knew. And then while I was over there, I got a fax. Anybody know who doesn't know what a fax machine is? Because this is an age now where people don't always know what it is. So I got a fax from the United States, from the Red Cross, saying that my wife was ill. Okay. My wife's ill, whatever, I'm in combat, whatever, just tell her to go to the doctor. Then I got a second fax and a third fax, and it said that her status was guarded. Her status was critical. And then I got a fax that said, my dad's having abdominal pain and was terminal. What? So finally I was able to get to a phone to call home. And I called the hospital that I worked at, which was the same place that she was at. And they said, oh, you don't know what's going on? And I was like, no, I'm in Iraq. I can't just turn on the news and say what's going on. So they said, well, let me transfer you to her. And she was up in the PEDS unit because they wanted to keep her away from everybody and kind of private because they knew that she was my wife. She was 23, but she was in the PEDS unit. And she said, yeah, I have something wrong with my stomach, Dave. I was nausea, vomiting. They found something in there. They're going to go in and do surgery and cut it out. She really didn't quite know how much was going on, but she was also slightly altered because of the medication she was on. Then finally got the last fax, and the fax said, Dr. Centeno states David Olvera's wife, Tiffany Olvera, has 4th stage terminal cancer and needs to come home immediately. Okay, now, if you're on shift in the ambulance, okay, hey, I'm done for the day. I'm out of service. I was across the world and got that news and had to try and perform. And so because of the unit I was in and what we were doing, I had to continue to work for a little bit longer. I couldn't concentrate. And I finally turned to my leadership and I said, look, I will do the best I can to help out, but all I can think about is my wife at home dying, and I hope I can get home to help her. So I finally got home, and we lived a marriage in about 14 months before she passed away. Okay? I wasn't ready for that day. We had talked about it. It was really interesting. A week prior, she says to me, she says, Dave, it's getting harder and harder to wake up. And so we had gone, and I said to her, I said, I want you to help me with some of these decisions that I have to make after you die. I said, where do you want to be buried? And so we went to the location where she wanted to be buried. We set up the area, the location, all of that. And then the day that the night we were playing Monopoly. It was the first night that my in-laws let my dad stay over, and Tiffany and myself and my friend Carlina were all playing Monopoly. I was winning at Monopoly. I never win at Monopoly. And I went to say something, and all of a sudden the table was shaking. And we were in the bed, in the hospital bed at home, and the Monopoly board started shaking. And I looked up. There was Tiffany doing this. having a full seizure. She had little twitches throughout the days because of all the medicine she was on, because of all the pain medicine that she was taking. She had an NG tube. Everything had to go through the NG tube because she couldn't eat. Her favorite thing was ice chips. She could barely do that. And all of a sudden I look up and she's having a full seizure. And I went, oh shit. I had my medic bag ready to go. And I said, all right, let's get a line in her. Let's tube her. And then I went, how about you be her husband? So we called 911, and we were in a local town, small town. Everybody knew who we were. So it was the first time that, my understanding, it was the first time in recorded history at this, in this town that the radios went silent when they called out for help. Her biggest fear was suffocating. And she said to me, Dave, if anything, please don't let me suffocate when I die. Okay, no pressure. So we had an electronic bed. It was a hospital bed. So I laid her head back a little bit, and she was clenched down. So I put an NPA in, and I did a jaw thrust. And I leaned over and whispered to her, and I said, just take some deep breaths, babe. Just go to sleep. And you could see, after I had said that, you could see she finally got those deep breaths in. When the fire department finally showed up, they walked in the door. They had their equipment, and they all stopped. Because it was Tiffany. Everyone knew Tiffany. And so my friend Carlina's like, well, hey, I'll get the monitor. Dave, do you want to listen to lung sounds? And we put her on the monitor, and we had this rhythm. So I was on the phone with the medical director for the emergency room, and he says, what do you want to do, Dave? And I said, let's be realistic. Is there anything we can do? He goes, we can definitely bring her in and try and resuscitate her, but I don't know her quality of life. And I said, no, that's okay. So at 24 years old, I had just come home from combat, didn't even have a chance to kind of decompress from that. And now I had to pronounce my wife and basically say, let's let her go. Okay? So how do you move on? How do you move on from that? I was a mess. All right? I drank. I gave up on things. I just had a bad life. I was miserable. I sat on the couch about a year later. I had just something that hit me. I sat on the couch for a month and didn't move. I called out of work every day. I was late. I didn't care. And I was told, if you don't come back to work the next week, then just resign. So I did. So to speed this up here a little bit, I apologize. Let's talk about patient care. Let's talk about RARE when we're dealing with this. Our brains are now distracted. We just had one of our friends go down. What are we supposed to do? As Rob Bryant, who again is another great person to me, he talks about react, accept, reset, and engage. So that's what we need to do. We need to accept that something happened. Okay? We need to move on from it. We need to do the sniper breath or the breathing that we had just talked about with Mike. And we have to re-engage. Top Gun fans? Top Gun fans. Anyone? All right. So what happened in Top Gun? Something happened. He had a little bit of a failure towards the end. He moved out of the flight line. He got himself together and he re-engaged. Now, hopefully we don't see that again in Top Gun 2. I'm a little nervous, Mike, on that. I don't want to see Tom go down. Maverick. But we have to re-engage those things. So these are absolutely important things to do. So just to speed this up here, this is my dad. May 25th, 2020. The 24th, the nurse calls and says, hey, I don't feel well. I have a fever. I have a cough, but the doctor, the veterans home won't let me go home. 25th, I got a phone call about my dad, and these are the vital signs and things that are happening. Okay. It was clear that he had COVID. So what did my brain do? This. Where do I begin? How do I fix this? Where's the school? How do I cover this? They didn't talk about this in school. What the hell's going on? Why aren't you guys doing this? Come on, this is so simple right here. Why do I have to do this over the phone? Okay. And then I was able to have a Zoom call with him, and this is what I saw. My dad was unresponsive. He had this mask on him that was blowing air at him. But he was unresponsive. His labs looked like crap, and he wasn't breathing effectively, but we had this little air blowing at him. So with my brain, it did it again. What are you doing? I called the resident on the phone. I was like, listen, okay, you don't know who I am, and that's fine. But let's try some ideas here. Let's try something different. I really think these ideas may help things out. I know you're doing the best you can. You have 15,000 other patients, but let me give you an idea. If you don't like it, great. Let's try it. And if it doesn't work, then I'll shut up and walk away. And so I said, let's try Vapotherm. Okay. Vapotherm is kind of a positive pressure airflow that you have. And guess what? Look at his color. It worked. He was able to be responsive. He was able to be awake. Okay? So the rare idea worked. I was able to bring my dad home. And I was able to spend time with him until he passed away. And it was by using this mnemonic and bringing things together, I was able to have a clear head, talk to these doctors, and say, hey, I have this idea. So my mentor, my rock, was gone. How do I move on from this now? There he is, Joe. Joe's my best friend. He's trained in PTSD. What he does for me is if I have symptoms, he'll either press on my leg doing deep pressure therapy, he'll lay in front of me, and if I'm not quite getting it because I miss common things like a booger in my nose, he'll bark. And that's my cue that something's going on, I need to back away. If I have nightmares at night, he jumps on top of me, or he'll lick my face and he'll wake me up. If I'm having a bad day, he'll come over and he'll make sure that I'm over there petting his ears. His ears are my thing. Okay? So there are ways out there to move on. How do we bring this together? We know the different mnemonics we talked about, how we work when we're actually working with a patient. How do we clear our mind in real life? And what do we do to escape for a minute? Joe is my escape. Okay? Joe is my place to get away. And what I'm afraid of is of all the deaths that I'm hearing about because of mental health related issues from our providers. So there's areas where you can go. Don't be afraid to ask for help. People reach out to me all the time, and I help as best I can, at least get them directed in the direction I need to go to. And please email me anytime. I am a PTSD patient. I am a healthcare provider. And I work hard every day to make sure that my patients get the best care possible. So please, at any time, reach out. Thank you.
This has been a production of the FlightBridgeED Podcast, leading the way in pre-hospital critical care and emergency medicine education.